Hi, this is my cardiac video. So prior to proceeding to the video, I would like to ask for permission to record and upload this video as unlisted for my professor to view and grade. Do I have your consent?
Yes.
Perfect. My name is Renika. I will be doing a cardiac exam on you. I am a nurse practitioner student. I'm going to go ahead and wash my hands, put on some gloves. We won't, for this video, we will not be taking blood pressure, but we would take the patient's blood pressure while they're laying supine and while they're upright in both arms, and we would compare the findings. But for this video, we will not be doing that, just verbalizing. Next, we're gonna move on to the neck. I'm going to go ahead and visualize the neck, so go ahead and just lay your head back. I'm looking for the neck veins, looking at both sides for any pulsations. Perfect, and then next we're going to assess for the jugular venous distension. So I have some pillows propped under her, so she's at about a 30 to 45 degree angle. I'm going to have her turn her head to that side so I can see the jugular venous pulsation, so we can measure the pressure. We're gonna look at right above the sternal notch, and we're gonna look at the highest ping of the pulsation. We're going to do a little mark there. So let me get my Sharpie. Here's the sternal notch, and I see the distension. It's right about here. Awesome. And then we're gonna get my ruler, and we're going to mark from the sternal notch up to that point. So we're gonna put this here at the sternal notch, and we're going to measure. So it's about 2 centimeters on her, which is within normal range. We want the pressure to be less than 3 centimeters. So then I'll have my patient go ahead and just sit up for me. We're gonna move on to the carotid arteries. We're gonna palpate them, and when we palpate for the carotid, we wanna make sure we do it one side at a time. We don't wanna check them together because this will stop the blood flow to the brain. So we're going to check on this side. I'm gonna feel for it. Perfect. And when we're palpating, we're looking for the amplitude and the brisk upstroke. When we come to the other side, we're gonna feel for the carotid. Perfect, so both carotid arteries were palpable and they're a grade 2+. So then we're going to go ahead and auscultate those arteries as well. I'm gonna go ahead and use both my diaphragm and my bell to check the artery. So first we're going to do with the diaphragm. You're gonna have a listen. Perfect, and then we're gonna switch over to the bell and listen again. Perfect, and we're gonna go to the other side. We'll start off with the bell on this side and have a listen. And then we're gonna switch to the diaphragm and listen one more time. Perfect. And so when I listened to her carotid arteries, I didn't hear any bruits or thrills bilaterally, which is normal. Next, we're going to go ahead and visually inspect her chest. So I'm looking at the chest wall to see if there's any abnormalities. I'm looking at her sternum. Her chest looks symmetrical. She has no pigeon's chest, no rashes, no lesions, no bruises, no deformities. I'm also looking for any apical impulse or precordial pulsations. So as I'm looking at her chest, I don't see any of that, which is a good sign. After the visualization, we're gonna move to palpation. First, I'm gonna palpate for the point of maximum intensity. So this is the location where the cardiac impulse can be best palpated on the chest. This can be found at the 5th intercostal space at the midclavicular line. So I'm gonna go ahead and feel right here. We're gonna palpate. Perfect, and I don't feel any bruits, thrills, leaves, or lifts in that area. Thrills, leaves, or lifts. Next, we're going to palpate all the other oscillatory areas in the cardiac region. We're going to start off with the aortic, which is at the right of the sternum at the 2nd intercostal space. I'm going to go ahead and palpate here. Perfect, and then we're going to move to the pulmonic, which is on the left of the sternum at the 2nd intercostal space, over here. And then we're gonna move to the herbs point. This is at the left medial sternal border on the third intercostal space. So just kind of right over here. And then we're gonna move to tricuspid, which is on the lower left sternal border at the fourth intercostal space. We're gonna palpate here. Perfect. And lastly, we're going to palpate the mitral, which is at the fifth intercostal space at the midclavicular line, which is right over here on this side. And then when I palpated, I didn't notice any bruits, thrills, leaves, or lifts, which is a good sign. So after we palpate those areas, we're going to palpate the abdominal aorta. This can be found above the umbilicus. So once again, I'm looking for any bruits. So I'm gonna find her umbilicus right there, and then I'm gonna palpate. And no bruise noted at this time. After that, we're going to auscultate all these areas that we just palpated. We're gonna auscultate with both the diaphragm and the bell. So I'm gonna start off with the diaphragm and go in the same order that I palpated. We're gonna start off with the aortic, pulmonic, herbs point, tricuspid, and lastly the mitral. All right, and then I'm going to auscultate the same areas but using my bell now, so we're going to switch that over. We're going to go back to the aortic and pulmonic. And then we're going to go to herbs point, tricuspid, and lastly mitral. Perfect. We're also going to auscultate the abdominal aorta as well with both the bell and the diaphragm. We're going to find the umbilicus, you're right above. We're going to start with the diaphragm. And then we're going to do it with the bell as well. Perfect. Once we're done auscultating all those areas, we're going to move on to the peripheral exam. So I'm going to start off by observing all of her extremities. So we'll look at her arms first. If you want to just go ahead and give me your arms. So we're looking for color. Her color is appropriate to her race. The skin feels warm and dry to the touch. We're looking for any abnormalities, any lesions, any edema, varicose veins, any shunts. We'll look at the other arm as well. So same thing, we're just kind of looking. And then we're also going to look at her lower extremities. So we're going to grab her leg. If it's easier, we can have you lay down and we'll just have a look. Perfect. And then we're going to look at her lower extremities. Same thing, look at color, feel for that it's warm, no varicose veins. Awesome. Now we're going to assess for all of her pulses. We're going to start with the radial pulses. So if you could give me both of your hands, Annette, and we're going to feel at the same time. We're making sure to see that they're bilateral and even, which they are, and they're at a grade +2. So next we're going to we're going to feel for the brachial pulses. So I'll go ahead and have their arm bent like this, and then we're going to feel it right here. Perfect. And then the other one, have her arm up. Perfect. You can feel both of them. They're palpable, even. They're at a grade +2. Next, we're going to move on to her femoral pulses. We're going to auscultate and palpate for both of these. So I'll go ahead and auscultate first with my bell and my diaphragm. For this video, she's going to keep her clothes on, but if I were to be treating a patient, we would do it directly on the skin. So I'm going to go ahead and auscultate for her femoral. First, we're going to do it with the diaphragm. On this side. And then we're going to switch over to the bell and we're going to listen one more time. Perfect. Then we're going to go ahead and palpate for the femoral arteries. Perfect, and they're palpable bilaterally at a +2 grade. Next, we're going to move on to the popliteal pulse. This is behind the knee, so I'll actually have my patient bend her knee. I'm going to use both my hands. I'm going to go underneath to feel for that pulse. Perfect. Lay this down. Go ahead and raise this knee up for me. Both hands again to feel for that pulse. So the pulses are palpable bilaterally again at a grade +2. We're going to move on to the dorsalis pedis pulse, which is on the foot. So we can have you put it up if you like, and then we're going to feel further. Actually, right about here. Awesome. So I can feel that bilaterally, grade +2. Lastly, we're going to check for her posterior tibial pulse, which is kind of behind the foot near the Achilles. So we're going to go and turn and refeel this side first. Perfect, and then this side. All right, I was able to palpate both of those at a grade +2. Next, we're going to check for cap refill in both fingers and toes. So we'll go look at her fingers first. And while we're looking at the fingers, we're also looking for any clubbing, cyanosis, splinter hemorrhages, tar staining, anything like that. So we're going to have a look at her fingers. And since she has nail polish, we're not really able to assess the cap refill on her nail bed, but we can kind of do it on the tip of her fingers. We can go ahead and press and see that the refill is within 3 seconds. We'll have a look at the other side as well. And we'll do the cap refill. Perfect. Then we're going to move down to the toes. So we'll have a look at the toes. Same thing to see if there's any clubbing, cyanosis, and then we're going to check for cap refill. Perfect, and then on this toe. Awesome, and that ends my cardiac exam. Do you have any questions for me?
No.
Perfect, thank you.